drugs in peptic ulcer disease. Okay, let's go and improve your peptic ulcer and medication knowledge. You can do it. Firstly, what are peptic ulcers? Peptic ulcers are open sores that develop on the mainly inside lining of the stomach and the upper portion of your small intestine and inside lining of the lower esophagus wall. So peptic ulceration commonly involves stomach, duodenum, and lower esophagus. So, peptic ulcers are open sores that form in the lining of your digestive system. They can occur in three main places. Number 1, stomach or gastric ulcers. These form inside the stomach itself. Number 2, duodenal ulcers. These are found in the first part of your small intestine, called the duodenum. Number 3, esophageal ulcers. These develop in the esophagus due to the backward flow of stomach acid or hydrochloric acid from the stomach into the esophagus. What do you think are the symptoms of this? That's it. Burning sensation of stomach or heartburn, abdominal pain, feeling of fullness, loss of appetite, nausea and vomiting, abdominal bloating, stool discoloration, fatigue. Okay, next one. The most common causes of peptic ulcers: Helicobacter pylori infection and non-steroidal anti-inflammatory drugs associated ulcers. In addition, can make symptoms worse. Risk factors are mental stress, spicy foods, smoking, alcohol consumption, and genetics. Okay, now let's talk about Helicobacter pylori infection. Did you know there's a tiny acid-resistant bacteria living in your stomach? Meet Helicobacter pylori, commonly called H. pylori. It naturally resides in the gastric mucosa of your stomach and GI tract. For most people, H. pylori is harmless and causes no problems. But if other risk factors come into play, like poor diet, stress, or smoking, this bacteria can stir up trouble. It can irritate the gastric mucosa, leading to inflammation and eventually ulcers. And in some rare cases, this infection may increase the risk of stomach cancer. The good news, H. pylori infections are treatable. Next one, NSAIDs-associated ulcers. Did you know that regular use of painkillers like aspirin, mefenamic acid, and ibuprofen can harm your stomach? These medications, called NSAIDs or non-steroidal anti-inflammatory drugs, are commonly used to relieve pain and inflammation, but they can also irritate the gastric lining. With frequent use, NSAIDs can cause damage to the gastric mucosa, leading to ulcers. This happens because they reduce protective stomach mucus, making the stomach more vulnerable to acid. Let us now talk about the treatment of peptic ulcers. What are the goals of treatment? First, the goal is to relieve the pain. Pain is one of the most common symptoms patients experience, and managing it effectively is essential for comfort and well-being. Second, we aim to improve healing. This involves promoting recovery through medications, therapies, or other interventions, allowing the body to repair itself as quickly as possible. Finally, we work to prevent recurrence. Once a condition is under control, we focus on preventing it from happening again. This could involve lifestyle changes, preventive medications, or regular checkups. Treatment? Let's talk in 4 groups. Antacids. First, we have antacids. These work by neutralizing the stomach acid that's already been secreted, providing quick relief from symptoms like heartburn. Anti-secretory medications. Next are anti-secretory drugs. These reduce the production of stomach acid, preventing further damage to the ulcer. Common examples include proton pump inhibitors and H2 receptor antagonists. Gastro-protective agents. Then, there are gastro-protective chelates and complexes. These form a protective layer over the ulcer, shielding it from acid and promoting healing. Helicobacter pylori eradication. Lastly, if Helicobacter pylori bacteria are the cause, eradication therapy is essential. This typically involves a combination of antibiotics and a proton pump inhibitor to eliminate the bacteria and allow the ulcer to heal. Okay, let's explain these one by one. Antacids. Antacids are medications that neutralize stomach acid that's already been secreted. This helps relieve symptoms like heartburn, indigestion, and upset stomach. Now let's break it down. 1. How antacids work. They directly neutralize the acid present in your stomach. This is different medications that reduce acid production. 2. Liquid versus solid forms. Liquid antacids are generally more effective because they spread quickly over the stomach lining. If you're using tablets, make sure to chew them thoroughly before swallowing for better results. Three common ingredients. Antacids often contain aluminium or magnesium compounds. Examples include aluminium hydroxide, magnesium carbonate, magnesium hydroxide, magnesium trisilicate. 4 side effects to watch out for. Aluminium-based antacids can cause constipation. Magnesium-based antacids might lead to a laxative effect. That's why many products combine both aluminium and magnesium to balance these side effects. Okay, our second group is anti-secretory medicines. There are 3 main types of anti-secretory medicines: H2 receptor antagonists or blockers, proton pump inhibitors, PPIs, and prostaglandin analogues. First of all, do you know what anti-secretory medicines are? The answer is any drug that reduces the normal rate of secretion of a body fluid, usually one that reduces acid secretion into the stomach. Okay, let's talk about H2 receptor antagonists or blockers. H2 receptor antagonists, H2RAs, also known as H2 blockers. H2 blockers work by blocking histamine H2 receptors on the parietal cells of the stomach. This reduces acid production, helping treat conditions like acid reflux, ulcers, and indigestion. Common H2 blocker drugs: cimetidine, famotidine, ranitidine, nizatidine. Side effects. These medications are generally well tolerated, but some common side effects include diarrhea, constipation, headache. Cimetidine may cause some specific side effects, such as gynecomastia, enlargement of male breast tissue, impotence, difficulty in maintaining an erection. What about pregnancy and lactation? Manufacturers advise avoiding H2 blockers during pregnancy and breastfeeding unless absolutely necessary. Always consult your healthcare provider before use. Next one is, let's talk about proton pump inhibitors, or PPIs, a group of medicines widely used to reduce stomach acid. How do PPIs work? PPIs irreversibly block the proton pump in the stomach lining. This pump is also known as the hydrogen-potassium ATPase enzyme system. By blocking it, PPIs significantly lower stomach acid production. Common PPI medications include omeprazole, pantomeprazole, lansomeprazole, rabeprazole. Side effects. While PPIs are generally safe, some people may experience abdominal pain, diarrhea or constipation, headache, flatulence, nausea and vomiting. Pregnancy and lactation. Manufacturers often advise caution. PPIs can sometimes be used during pregnancy, but only under medical advice. Okay then, prostaglandin analogues, mainly misoprostol. How does misoprostol work? Misoprostol helps by reducing hydrochloric acid HCl secretion in the stomach, making it useful in conditions like gastric ulcers. Common side effects. Like any medication, misoprostol has side effects. The most common ones include abdominal cramps, abnormal vaginal bleeding, dizziness, dyspepsia, indigestion, diarrhea or constipation, flatulence, headache, nausea and vomiting. Pregnancy and lactation. Misoprostol should not be used during pregnancy as it can cause serious complications, including miscarriage. For breastfeeding mothers, it can be used only if necessary. Manufacturers recommend that women of childbearing age should avoid misoprostol unless pregnancy is ruled out. Here we have finished talking about the 3 main types of anti-secretory medicines. If there are any forgotten places, rewind the video and try again. Next, the third group that we will talk about under our peptic ulcer treatment is the gastro-protective complexes. Gastro-protective complexes are medications designed to form a protective coating over ulcers and mucosa, helping to shield them from stomach acid and other harmful factors. Produces a protective barrier over ulcers and mucosal surfaces. Main drugs. Sucralfate forms a protective layer over the ulcer site. Side effects. Constipation. Bismuth creates a protective barrier over the stomach lining. Side effects, nausea and vomiting. Okay, lastly, Helicobacter pylori infection and eradication. Helicobacter pylori, commonly known as H. pylori, are bacteria that can infect the stomach or duodenum, often causing peptic ulcer disease. This infection can lead to inflammation and irritation of the stomach lining. Symptoms: abdominal pain, bloating, burping, loss of appetite, nausea, vomiting, unexplained weight loss, bloody, dark red or black stool, dizziness or fainting, fatigue, pale skin color, vomiting with blood or coffee grounds appearance. Prevalence: H. pylori infection is common, with about 2/3 of the world's population carrying it in their bodies. For many people, it does not cause symptoms or ulcers. However, for those experiencing issues, medication can be used to eliminate the bacteria and promote healing. Treatment: first-line therapy. A combination of a proton pump inhibitor, PPI, with 2 antibiotics for 7 to 14 days. Common regimens include lansoprazole 30 mg plus tinidazole 500 mg plus clarithromycin 250 mg BD, lansoprazole 30 mg plus amoxicillin 1000 mg plus clarithromycin 250 mg BD. If you found this video helpful, give it a like, share it with others, and don't forget to subscribe for more medication insights.